Hi there, it's July the 24th and it's now mandated that you have to wear a mask in the shops. So I just thought I'll do a little sketch explaining maybe some of my thoughts. You can get quite flimsy masks that you see people quite often wearing. Now the problem is, if you wear a mask and you start touching it and your hands are everywhere, then arguably you've got to question what the purpose of the mask is. Now, you can get better grade masks, which you can get filters for. But the problem again is that your nose and mouth effectively hoovers. So if you don't keep looking after your mask, and as a reusable mask you don't keep washing it on a regular basis, the danger is you could get bacteria, and that could then lead to other things like a fungal infection and things like that. So you have to really be careful in looking after your mask. The other important thing is if you're going to touch your mask, touch it after using some hand sanitizer. That way then you're not touching potential infections and then touching your mask, which then starts to spread. Okay? The other thing I highly recommend are getting things like, kind of like wet wipes, so like antiviral wipes that you can get. And then you can open them up and you can clean things like surfaces or cutlery or plates and things like that. And you can also use them, if you wish, to open doors and keep the integrity of your hands. Arguably, you could use tissues for that as well. Regarding hand hygiene, I'd highly recommend, one of the best things to do is to use soap and water. But obviously, if you're out and about in the shops, that's difficult, and that's why you need to use the hand sanitizer. Now, I run a care company called Home Instead Senior Care, and we've operated throughout the pandemic and none of our clients have become infected. And the crucial thing you've got to do is make sure that your caregiver wears their PPE properly. They use a proper mask, a fluid repellent surgical mask, okay, which has got the protection for the caregiver as well as the client. And there are special procedures you've got to follow so that once you put the mask on, you don't start touching it and doing things like that, because you lose the whole integrity of the situation. Okay? Similarly, you've got to be careful in how you wear your gloves. And if you're wearing gloves all day, every day, it really isn't achieving much. So when a caregiver wears their gloves, they use it for a particular procedure and then keep changing the gloves. Okay? Likewise, wearing aprons and things like that. And probably one of the most important things is you're continually washing your hands if you're not already using your hand sanitizer.